Infertility is, for most people, something we don't necessarily ever have to think about. But for 1 in 8 couples, that is a harsh reality when they're trying to have a baby, but they just can't. Hello, everyone. I'm Jason Allen. Thanks for joining us today on Plugged Into DFW. It's an interesting issue. It's also a very complex issue. And so today we're going to try to take an in-depth look at this issue for you. Infertility, genetic testing, egg freezing, increasing your chances for a healthy baby. There is a lot to talk about, and here to talk about it with us is reproductive endocrinologist and infertility specialist, Dr. Laura Lawrence with Dallas-Forth Worth Fertility Associates. Thanks for doing this with us. You know, I think there's a lot of talk sometimes. We hear so much about trying not to have children that sometimes we forget about talking about those people who really struggle to do it. Just how many people really struggle with this problem?
You know, Jason, 1 in 9 couples will face infertility in their lifetime. So it's a much more common experience than you know. I think, unfortunately, a lot of it is shrouded in mystery because many of us feel that when we're ready to have a child, that this is something that's very personal and it's difficult to open up sometimes even to your mother or to your family.
And you feel like it's just going to happen and there's not going to be any struggle with it.
And that it should happen, that it should just be natural. And let's face it, it's much more romantic when it happens on its own and that you're not trying to have a baby timed with a pregnancy predictor kit or things like that. And I think that there is some social stigma to it. I myself, when I was diagnosed with polycystic ovarian syndrome, which doesn't allow you to ovulate, I didn't tell my mom. I told my mom only after we had conceived, I think, the second child.
Does the difficulty usually lie with the woman, with the man? Is it evenly split?
It's evenly split because about 30% of cases are purely male infertility, and then another 20 are shared. So when you add that up, it's about 50% that have a male factor involved. So. And
I think a lot of people are probably always going to wonder what causes this? What's the problem with me or with my partner? Was I born this way? Did I do something wrong here as I lived my life?
Well, there's a number of factors that can contribute to infertility, and that's why sometimes it's helpful to, when you're having difficulty, to look for help, because there's some easy testing that we can do to take a look at what the root cause is. Unfortunately, in about 25% of cases, there's no discernible cause. And I tell patients the grass is always greener on the other side. For the patients who have a diagnosis, oftentimes they feel like, wow, if I didn't have a diagnosis, sometimes the treatments can be less expensive or less invasive. And for those that don't have a diagnosis, there's the frustration of not knowing where the problem is and why it's not happening more easily. Well,
you said you didn't want to tell your mom. Mm-hmm. So at what point, as you struggle with this, do you go tell somebody? What point do you realize something's not right here, I need some help?
Well, we say that for couples where the female partner is under 35, we recommend that you give it 12 months of intercourse every 2 to 3 days, or if it's clustered around the time of ovulation, if you know by a predictor kit, give it 12 months.
That's a good amount of time. I'm sure there's a lot of people who worry well before that something's wrong, but give it a year.
Sometimes, but some people will let themselves get out to 2, 3, 5 years, just because when we get married, we want that time to be able to share with our spouse and not have to worry too much. And so sometimes we don't really we're having such a good time, we don't even look up to say, wow, it's been 2 to 3 years of regular intercourse with no birth control. I wonder if we should have been pregnant by now.
And over 35, you don't have quite as much time.
6 months.
Within 6 months, look for some help. Mm-hmm. Okay. We have a lot to talk about here.
Great.
We have time to take a quick break here, but coming up, treatment options available to treat infertility. And with many women working on their careers first, right, before they have the family, some companies are offering some interesting fertility insurance perks. We're going to talk about that. And can genetic testing really increase your odds for a healthy baby? That's coming up.